Hi Farmies. I'd like to talk to you about Doxazosin. Doxazosin is an antihypertensive medication. It's a medication we give to our patients to lower blood pressure, and it is an alpha-1 antagonist. So what is alpha-1? Let's break that down. Alpha-1 adrenergic receptors are stimulated by the sympathetic nervous system. So here's your sympathetic side. It's the stress side of the nervous system. It's activated, when we activate it, we get that fight or flight response. So when your body has stress, when we interpret stress, here's your brain having some stress, it sends a message to the sympathetic nervous system, which then stimulates the alpha-1 receptor, and we get blood vessel contraction. So in order to treat that, we're going to block this receptor. So we're going to block alpha-1, and when we do that, we treat hypertension by the resulting vasodilation, because when we block this, we don't get the contraction. Now we have dilation, and when we dilate our blood vessels, we get a drop in blood pressure. It can also be used to treat benign prostatic hypertrophy, because these receptors are located in the smooth muscle tissue of the blood vessels and the bladder. When we treat BPH and relax that muscle, we get an increase in urine output, which also gives us that decrease in blood pressure. So that's how they work. That's how we get a reduction in our blood pressure and through this vasodilation and relaxation of smooth muscle. Something you need to be concerned about is, again, if we do too much of a good thing, we end up with hypotension. So think about all of the nursing interventions that you would want to put into place to monitor a patient who has low blood pressure. Hypotension, so orthostatic hypotension, fall risk, don't operate heavy machinery, start with small doses. All of those type of interventions go along with this medication as well. So there you have it, Doxazosin, an alpha-1 antagonist.